Hi guys, Dr. James here, founder of Illuminate and also biomedical neuroscientist, specialist in exercise therapy and also exercise physiology. Today we're going to talk a little bit about sciatic nerve pain and the exercises that we do here in the therapy center to kind of help people with sciatic nerve. First of all, we're going to talk about what is it and how do you get it, and then my sequence of exercises in terms of managing sciatic nerve pain. Now, to understand sciatic nerve pain, we got to have a little anatomy lesson for a moment. Sciatic nerve is a bundle of nerves. Your nerves come all the way down your spinal cord in your back, all the way down your spinal cord in your back, as you can also see here. And then it branches out at different levels here, all the way down your vertebrae. The bottom nerves come together in a sheath right here, comes together right here. L4, L5 comes together in a sheath right here, as you can see. Remember that the sciatic nerve are actually three nerves bundled together in a sheath that comes out and goes down the leg into the foot. And so the sheath is a bundle of nerves that is called your sciatic nerve. Your sciatic nerve. Okay, remember that. It's coming out of your back. It's coming all the way down. It's going to come out of your glute. When it comes out of your glute, it's bundled together, and it's going to be three nerves bundled together. It's going to go down your leg. I'm going to show you this in the picture. If you can see this sciatic nerve pain right here, you can see this right here. You can see how it's coming out of the glute, right? Coming all the way down the back, comes out of the glute, and it's bundled together into a sheath, and it goes all the way down the leg, even into the foot, right? That's how it happens. L4, L5 is where it's going to come out from. So let me show you this picture right here. Here's a better picture of what I'm talking about. Remember I told you that the sciatic nerve comes out of the vertebrae. It comes out and around L4, L5 at the end of the vertebrae. You can see them coming out individually, and then it comes together, binds in a sheath, and it comes all the way down the leg. This is that sciatic nerve, and that sciatic nerve pain is coming all the way down, even into the foot, right? All right. Sciatic nerve pain or sciatica is not a diagnosis, it's a symptom. Again, it's not a diagnosis, it's a symptom. In actuality, it's not just pain. It could be any tingling, any numbness, anything of pain, any type of altered sensation is sciatica. Okay, now there's different causes for sciatica. Remember we talked about sciatica nerve pain is not a diagnosis, but we talk about different causes of sciatica. It could be a bulged disc. It could be joint inflammation, is the taking up of space. It could be a stenosis, where there's a narrowing of a canal. It could be an SI joint pain, or it could be a piriformis muscle tightness. That piriformis muscle is a muscle that goes right across here, and your sciatic nerve kind of comes right out in between that piriformis muscle in your glutes. It's a piriformis muscle is there, and so it comes out in between that piriformis muscle. So if that piriformis muscle is tight, it could be pressing up against that nerve, and so therefore it's irritated. Now, what we're going to concentrate on though is a bulging disc. Our vertebrae column is made up of a series of bones stacked on top of each other. And in between those bones, you have a disc, and that disc is called an intervertebral disc, right? And so this disc is made up of really tough cartilage that's woven together. That woven together tough cartilage right here that you're seeing is what you will call an annulus fibrosus. And within that annulus fibrosis, in the center of that, you're going to have what is called a nucleus pulposus. That's that jelly-filled like substance that you can see kind of right here. That's that jelly-filled substance that you can see right here. Now, that's an amazing structure, because that amazing structure causes us to move in a whole lot of ways. It takes the compression. When we're bouncing up and down, we're jumping up and down, or when we're moving from side to side, or you're going frontward, or you're going backward, you have an ability to do that. It gives us the great ability to do that. However, being like a jelly-filled donut, I want you to think about things like a jelly-filled donut. And when you think about things like a jelly-filled donut, in between, and you've got the jelly in between there, right? If you start bending down, you're pressing. Now, remember that jelly-filled donut, when you start to bend and you're bending this way, that disc, that nucleus pulposus, is being squished, right? It's being squished towards the back. Every time you're going down this way, it's being squished towards the back. All right, so you got to remember that. So you go and pick and drop down to pick up something and pick it up wrong, and then come back up, remember that you're squishing that jelly filled scenario out this way. And it can happen like this, where you're squishing it and all of a sudden it has a bulge in it. That's what basically happens. So when you're going forward all the time, we do this more than we do this. We bend forward more than we bend backwards. And so that's how you end up with this disc problem here. That's how you end up with having that bulging disc, because we're always doing this. We don't always do this. We're doing more of this than we are doing this. And so you end up with that bulge. Now, I'm going to get into some exercises, but before we get into some exercises, I want to tell you something about what we really need to happen. And what we really need to happen is this. When you talk about exercising, how can that exercise become medicine? How can it help? One of the things that I want you to remember is that we got to do something called centralization. Centralization, that sciatic symptom is decreasing and getting closer to the back. So in other words, instead of it going all the way down the leg, because that's what happens, sciatic pain, it starts going tingling, it starts paining, it starts numbing. You feel numbness in your feet, you feel numbness in your toes, you feel numbness going down. That can happen. But what we want to do is bring that pain back up. Any exercise that causes it to become peripheral, which means going towards the leg, is wrong. When we can bring it back up and centralize it in the back and keep it in the back, that's when we're going. Remember, peripheralization is when the symptoms of sciatic pain is increasing and is going further down the leg. What we want to do is we want to centralize it. We want to bring it back up and centralize it so we can eventually get rid of it. What we want to do is we're going to try to make sure that without surgery, we're going to do, this is a non-surgical, non-invasive kind of exercise. We're going to do is try to get this to go right back into place. And in order to do that, we've got to do the right kinds of exercises, because trying to get things to become centralized and not peripheralized in terms of it going all the way down. So what I'm going to do is I'm going to show you some exercises. So let's get into some exercises for sciatic pain, nerve pain, as it relates to a bulging disc. So Shantae is going to help me, all right? So what we're going to do first is get her to lie down on her stomach. And I want her to lie flat. Now, sometimes trying to lie flat down, you can feel a lot of pain if you have a bulging disc, sciatic nerve pain, you have a bulging disc. So what we can do is make the patient kind of comfortable, so we can put a pillow right there underneath her. Kind of make her kind of comfortable like that if we have to. If we have to raise her up a little bit, then we'll do it just like that, okay? All right, so I'm gonna take this pillow away. Okay, good. Now, one of the first places I'm gonna put her is straight like this, because remember that you always bending over, and bending over, that disc is going this way, and the jelly filled part of that disc can scrub the back. So what we wanna do is we wanna bring it this way. Okay, instead of going this way all the time, we're going to bring it this way for that bulging disc. All right, so that's one way that we're going to do it. Then I want her to come up on her elbows just a little bit for me, just like that, leaving her pelvis on the floor. That's one, another position. That's one level. So we had level 1, and then this is level 2. All right, level 1, level 2. Then I want her to raise up just a little bit for me, just a little more. That's level 3. All right, remember, we're trying to keep this pelvis on the table, and we're going to be trying to work in this particular area right here. Level 4, all the way up, leaving her pelvis on the table. Leaving her pelvis on the table, lift all the way. All the way, good. Just extend that arm for me. Extend that arm. All right, this is the last level that I kind of want her on. All right, so this is the position that I want her in. What I don't want her to do is lift her pelvis all the way off the table like that. That's the wrong thing to do. I need her to have her pelvis on the table and lift it up. And you're going to hold that for about 5 seconds. Each level of this that we're talking about, you're going to do it for about 5 seconds, and then you're going to go back down, okay? Then I want you to lift back up again, all the way up, extend it all the way up. You're going to hold it for about 5 seconds, and then you're going to go down again. Okay, good. The next one I want you to do is I want to have her is to stand up on the floor. All right, I'm going to have her stand up on the floor. And then what I'm going to have her to do as she's standing up is I'm going to have her bend all the way back. All the way back. Good. Going to hold it for about 5 seconds. And then I'm bring it back up. We're going to do it again. I'll hold it all the way back for about 5 seconds. Good. And bring it all the way up. Okay. We're going to do it again. Hold it for about 5 seconds. Good. And we can bring it all the way up. Now, Dr. James, and I hope this has been helpful to you.